with us. What I'd like to do is just go over the day a little bit with you, and then I'm going to hand it over very quickly to our co-chairs. And I think everybody should have an agenda in front of you. First of all, our foundation has been around for 40 years. We started supporting research for new vascular scientists and surgeons when there really wasn't funding to do that. And there still is not enough funding, in the vascular space. We all know that. But it has changed over the years. And so as it's changed, we have developed as well. And we understand the importance of getting patients engaged in the work that is done on the research side, producing educational materials that help patients take an active role in their own health, but also in the whole health ecosystem. And so that's a big part of the focus of what we do now. And so when we look at research and we talk about innovation, we try very much to talk about it through the lens of what's the experience for the patients, what's the experience for the caregivers, what's the experience for the family. And research defined by us now as we fund it is very much with an eye to what is the impact of that research going to have in, we hope, the short to medium term, not the long term, right? So we're really thinking about translation, we're thinking about operation. And we're thinking about ethics, and we're thinking about inclusion. And so we're trying to bring that into today in the context of digital health, of machine learning, of AI, technological changes that have the potential to really make improvements, but also have some dangers attached to them, and we want to make sure that we do it well and thoughtfully. So with that, our CMO is Michael Conti, who I think everybody in this room knows. He's the Chief of Vascular Surgery at UCSF, but he's not yet. But he's one of our, the co-chairs of this summit and one of the big thinkers of this summit. And then the other co-chair of the summit is Dr. Manesh Patel, and he's the Chief Division of Cardiology and Division of Clinical Pharmacology at Duke, and he's on our advisory board, and we're really grateful to him. In terms of the day itself, so we have talks and we have panels. We have Q&A through the day. We really encourage people to speak. We want to have a discussion. We try to keep these meetings small so that we can have those discussions. And it's a priority for us that that happens and that we exchange ideas. And we've worked really hard to get you here, who are all experts in different areas, to come together and exchange those views, because we believe very much that that multi-institutional, multi-view perspective is critical to change. So that you know, we have breakout sessions at the end of the day. I know that we've been in touch about which one you want to be in. You can change later on in the day if you feel really strongly about that. But do know that the reason we do the breakout sessions is that our goal is to identify the areas where pilot research would be most useful. And from those sessions, we have convenings afterwards with our committees, and we end up putting out RFAs. And this year we'll put out 2 for pilot research, and they're small, but they are enough to get that sort of ground data that is needed to apply for the big awards. And we really try to steward those projects to success. And again, our goal is implementation and change. And so we're not just about getting those projects funded, we're about making change happen. And we consider everybody in here partners with us. So with that, thank you very much. It's going to be a great day, and I'm looking forward to it very much. And I'm handing it over to Dr. Conti.
Well, good morning, everybody. First of all, thanks to Isabel and the staff who've done all the work and the logistics to make this a reality in this spectacular location. So when you see them throughout the day, our staff has been amazing. We have some wonderful interns and young people getting engaged in the organization. You'll meet them today and tonight, and we're very fortunate to have them, but particularly thank you to Isabel for all the huge labor she's put into thinking and planning for this. You know, this is really my favorite event of the organization. I've been Chief Medical Officer for now, I don't know, 10 or 12 years, maybe longer. And it's a great organization for many reasons, but this event is something we started doing, I don't know, about 7, 8 years ago. And the idea really was to build community, to bring thoughtful people together, to catalyze ideas about how to collaborate, you know, cross-institutionally, to do interesting things that we could help push forward in our own small way that have ultimately become big things. And also to allow people the chance to get to know each other, to think about how they might collaborate and to think about how they may fund their science, but also to help inform our board about where we should, you know, think about priorities to fund research and also to push agendas in the way that a nonprofit foundation like this can across its different intersections with professional societies and funders and stakeholders in industry as well. So this is a fun event. It's meant to be brainstorming, intimate, open, and hopefully people are comfortable sharing their thoughts and ideas in our space. We are here not to compete, but to collaborate. I very much am grateful to all of you who've traveled to be with us today, especially from potentially terrible weather on the East Coast, and I hope everyone can get in and get back to where they need to go safely. But while you're here, enjoy spectacular September weather here in the Presidio of San Francisco, in our beautiful city for the day. And I hope all of you, or most of you, will be staying with us tonight for our Circulate event, which is really a celebration of our foundation in so many ways, and it will be a lot of fun. So I hope all of you will be there tonight. Each year we pick a theme that we think is important in general in terms of the science of where the field is going, or maybe where we want to think about pushing it to go. And last year we talked about precision medicine, which is a pretty broad subject in general. We wanted to follow up on that with a little bit more focus on artificial intelligence and big data, because there's so much going on there. And yet a lot of it is sort of behind the wall. There's a lot of people doing things that are they're not necessarily transparent. There's a lot of things starting off the ground. There's a lot of ideas, and I think we all recognize the power, the potential tremendous power to improve the care that we provide patients, and also to inform the research in our field. And I think we also realize some of the risks and some of the limitations that are inherent there, and that's what we're going to be talking about today here all day. But you know, when we think about vascular disease in general, I think a large part of it has a very long preclinical phase that you don't see, and then the patient appears in the health system, usually with an acute problem or much later. And so we have to think about that when we think about which parts of this data are going to be representative of which of our patients. The data that we get in our EHR systems, it relies on people interacting with the health system. So there's disparities right off the bat as far as, are we really sampling the entire storyline of patients as we think about trying to predict everything from a vulnerable plaque to a vulnerable patient, which is really what this is about. What will we be able to do, and what will we maybe not be able to do? What will be the holes that we'll be missing, and how do we think creatively about that? You know, and as I've thought about this, one of the challenges maybe for the day is just to think about, you know, the promises of doing this, but also, would we get this information from the EHR that we got from the Framingham Heart Study, for example? If we had, you know, just for an example, if you think about a community-based study done over many decades, would we identify those risk factors the same way looking backwards through EHR? I'm not so sure. So there's an intersection here that we need to think about who interacts with the data, what data is available, and how it actually gets in there, and then what's missing. Because what's missing may be really important, especially for certain populations. I think that theme is going to come up a lot today as we talk. In any case, we have an amazing panel of speakers who are, you know, accomplished data scientists, clinical trialists, thought leaders in AI and precision medicine and machine learning. I'm really excited to bring all these people together. I'm really excited to learn myself today about what's going on in this field. And I'm going to start out with our co-chair, Manesh Patel, who's Chief of Cardiology at Duke. He's a well-accomplished clinical trialist in cardiovascular medicine, also a data scientist and a big thinker. And it's always great to see Manish here. So thank you so much for coming, Manish.